Nurse Aide Practice Test Prometric. Question 1. When measuring intake and output, INO, the nurse aide should record. Option A. Only water the client drinks. Option B. All fluids consumed, including ice chips, soup, and gelatin. Option C. Only oral fluids. Option D. Only 4 fluids. The correct answer is option B. All fluids consumed, including ice chips, soup, and gelatin. Intake includes all liquids and foods that become liquid at room temperature, such as ice chips, soup, broth, gelatin, juice, milk, and water. Recording only water or oral fluids misses significant fluid sources. Question 2. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A. Ignore the difference. Option B. Recheck it after 1 to 2 minutes. Option C. Change the client's medication. Option D. Document the first reading only. The correct answer is option B. Recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 3. Which statement demonstrates therapeutic communication? Option A. You should not feel that way. Option B. Everything will be fine. Option C. Tell me more about what happened. Option D. I know exactly how you feel. The correct answer is option C. Tell me more about what happened. Tell me more is an open-ended question that encourages expression, demonstrating therapeutic communication. You should not feel that way is judgmental. Everything will be fine is false reassurance. I know exactly how you feel assumes identical experience. Question 4. A client expresses sadness about not seeing their family. The nurse aide should: Option A. Tell the client they will visit soon. Option B. Allow the client to express their feelings. Option C. Change the subject. Option D. Call the family immediately. The correct answer is option B. Allow the client to express their feelings. Allowing expression of feelings validates the client's emotions. Making promises, A, may be false. Changing the subject dismisses the client's concerns. Calling the family, D, may be appropriate but is not the first therapeutic step. Question 5. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A. Feed the client quickly. Option B. Provide verbal cues to chew and swallow. Option C. Puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 6. A client who is confused becomes agitated. The nurse aide should: Option A. Give the client a sedative. Option B. Remove the client from the situation. Option C. Use a calm, reassuring voice. Option D. Tell the client to calm down. The correct answer is option C. Use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 7. To prevent skin breakdown, the nurse aide should: Option A. Keep the skin clean and dry. Option B. Keep the skin moist with lotion. Option C. Rub bony prominences vigorously. Option D. Use only powder on the skin. The correct answer is option A. Keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 8. When applying gloves, the nurse aide should: Option A. Wear gloves that fit loosely. Option B. Pull gloves over the cuffs of the gown. Option C. Wear gloves only for blood exposure. Option D. Reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 9. What should the nurse aide do if a client begins to choke during a meal? Option A. Call for help. Option B. Perform the Heimlich maneuver. Option C. Pat the client on the back. Option D. Give the client water. The correct answer is option B. Perform the Heimlich maneuver. If a client is actively choking, unable to speak, cough, or breathe, perform the Heimlich maneuver immediately. Calling for help can be done simultaneously. Patting the back is not the recommended primary intervention. Giving water can worsen obstruction. Question 10. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 11. A client with dementia frequently repeats the same question. The nurse aide should: Option A. Explain that they already answered the question. Option B. Answer the question patiently each time. Option C. Ignore the question. Option D. Write the answer on a whiteboard. The correct answer is option B. Answer the question patiently each time. Repetitive questioning in dementia clients is due to short-term memory loss. Answering patiently each time shows respect and reduces anxiety. Explaining that the question was already answered frustrates the client who cannot remember. Question 12. When a nurse aide is floating to a different unit, they should: Option A. Refuse to float to an unfamiliar unit. Option B. Accept the assignment but only do familiar tasks. Option C. Accept the assignment and ask for orientation to the unit. Option D. Accept the assignment and perform all tasks independently. The correct answer is option C. Accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs. Question 13. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A. Change the subject to something more positive. Option B. Tell the client to stop crying. Option C. Sit with the client and allow them to express their feelings. Option D. Leave the room to give the client privacy. The correct answer is option C. Sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 14. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 15. When disposing of contaminated linens, the nurse aide should: Option A. Shake them out before placing in the hamper. Option B. Place them in a leak-proof bag without shaking. Option C. Fold them neatly before disposal. Option D. Sort them in the client's room. The correct answer is option B. Place them in a leak-proof bag without shaking. Shaking linens creates aerosols that spread pathogens. Contaminated linens must be placed directly into designated bags without shaking, sorting, or folding. Folding or sorting would require unnecessary handling of soiled linen. Question 16. When assisting a client from lying to sitting position, the nurse aide should: Option A. Have the client sit up quickly. Option B, sit the client up slowly and allow time for blood pressure to adjust. Option C, pull the client's arms to sit them up. Option D, have the client hold their breath. The correct answer is option B. Sit the client up slowly and allow time for blood pressure to adjust. Sitting up slowly prevents orthostatic hypotension, dizziness, fainting. Sitting up quickly can cause a dangerous drop in blood pressure. Pulling on arms can injure shoulders. Question 17. When providing care for a client from a different culture, the nurse aide should: Option A, follow standard procedures regardless of culture. Option B, ask the client about their preferences and respect them. Option C, assume cultural preferences based on the client's appearance. Option D, ask the nurse to provide care instead. The correct answer is option B. Ask the client about their preferences and respect them. Asking the client about their cultural preferences shows respect and enables culturally competent care. Following standard procedures without regard for culture may be insensitive. Making assumptions based on appearance can lead to stereotypes. Question 18. A client with dementia has incontinence. The nurse aide should: Option A, place the client in adult briefs without offering toileting. Option B, offer toileting at regular intervals. Option C, restrict fluids to reduce incontinence. Option D, ignore the issue. The correct answer is option B. Offer toileting at regular intervals. Regular toileting maintains dignity and may prevent incontinence. Restricting fluids can cause dehydration. Ignoring the issue is neglect. Briefs may be necessary but should not replace toileting. Question 19. When should the nurse aide count an apical pulse for a full minute? Option A, always. Option B, only if the client is pediatric. Option C, when the pulse is irregular. Option D, when the client is sleeping. The correct answer is option C, when the pulse is irregular. An apical pulse should be counted for a full minute when the radial pulse is irregular to accurately count all heartbeats. Otherwise, counting for 30 seconds and multiplying by 2 is acceptable. Question 20. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 21. A client at risk for pressure ulcers should be repositioned how often? Option A, every hour. Option B, every 2 hours. Option C, every 4 hours. Option D, once a shift. The correct answer is option B, every 2 hours. Clients at risk for pressure ulcers should be repositioned at least every 2 hours to relieve pressure on bony prominences. Repositioning every 4 hours or once a shift is insufficient. Question 22. The nurse aide enters a client's room and finds the client on the floor. The aide should: Option A, pick up the client immediately. Option B, assess the client, call for help, and do not move the client. Option C, leave the room to get the nurse. Option D, document the fall and call the family. The correct answer is option B. Assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 23. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A, 1 inch. Option B, at least 2 inches but no more than 2.4 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B, at least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow, 3 to 4 inches may cause injury. Question 24. Which method of temperature measurement is considered most accurate? Option A, oral. Option B, axillary. Option C, tympanic. Option D, rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 25. Which position is best for taking a rectal temperature? Option A, Fowler's position. Option B, dorsal recumbent. Option C, Sims position. Option D, supine position. The correct answer is option C, Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back.